friends, this is Gunjan from MATLAB Helper and I welcome you to the third episode of the COVID-19 series. We had live streamed our webinar on data analysis, modeling and forecasting of COVID-19 on 25th of April, which we have considered as our episode 2 of this series. The webinar and hence the episode 2 is almost 1.5 hours long. It covers several aspects of this series and a must watch to understand what we have already done with COVID-19 data. Our organization is based out of India. During the first episode, I mentioned how the lockdown, which started on 25th of March, was extended to 3rd May. This lockdown was further extended until 17th May. And now the recent announcement from Prime Minister has made it clear that we are going for lockdown version 4. PM has also requested every Indian should be vocal about local products. I asked you to be vocal about MATLAB Helper and share this series with your colleagues and family and help us spread the awareness for COVID-19. India's self-reliance will be based on 5 pillars: economy, infrastructure, technology-driven system, vibrant demography, and demand. We are here to fulfill the technology-driven system and will try to meet your orders. In this episode, I'll be talking about our online quiz on coronavirus, specifically MH Quiz Contest April 20. The online quiz is still available and can be participated freely at the link which is shown on the screen. The quiz had received a lot of positive feedback and I personally feel it as one of the best quizzes we have ever organized. At the time of recording of this video, we had 547 quiz participants. The quiz does use the COVID-19 data until 9th April, so please understand this while seeing any plot or COVID-19 curves. The main period of the quiz was 11th to 28th April. All winners during this window got free e-certificate as well as showcased on our website winner showcase section with their testimonial. Out of about 400 participants during those 10 days, only 24 people scored 75% plus. The quiz wasn't hard, as you will see while we discuss each question. If you haven't participated in the coronavirus quiz even once, I'll recommend you to give it a try before watching this video further. Do pause this video, head on to the quiz page and simply start the quiz. It can't be more convenient than that. This is also important for you as we are going to discuss the answers to the quiz questions interactively. In the past, we haven't done any discussion on any of our completed quiz. Exceptional circumstances like COVID-19 require special efforts. This quiz, webinar and current episode are dedicated to all the frontliners who are working day and night for us. Let's start our discussion with each question of the online quiz. Here you can see the backend of the quiz. We use these data as an important parameter for tracking the performance of any quiz. For us and for this quiz of quiz April 20, we had 1479 people who have visited to the main page of the quiz. Out of them, 547 people at the time of this video have participated in the quiz. 70% of those participated people have reached until the opt-in stage, which means where you are putting up your name and email address. This step is essential for us to track your performance. It means how much you have scored, what kind of answers did you reviewed, etc. And out of those 381 people, 362 filled those details and so the result page. If you talk about the number overall, 381 people completed the quiz. 162 people shared this result page. That means 10.95% of the total visitor have shared the quiz and roughly 50% of those who have completed the quiz have shared the quiz online. If you found that quiz really good, I'm really pleased to know that. But if the quiz had some of the issues, again we would request you to let us know, notify us. We haven't received any of that complaint as such. Rather than talking about hard, easy or moderate questions, we haven't received as such any feedback regarding that. So I'm pleased with that at least. And overall 362 people have subscribed to this quiz, so that's a very big number in a way. Moving to the questions, I'll simply head on to the question section. So now we are going to talk about each question one by one. The page is loading. You can see the quiz page over here. The first question was, what is the general nature of COVID-19 curve against time? The four options were cubic polynomial, exponential, linear and Fourier. Some of you have selected cubic polynomial, linear and Fourier, which is incorrect. The correct answer is exponential. The general nature of a COVID-19 curve is exponential, and that's where most of the countries are trying their best to flatten the curve. The number which takes to increase from 1000 to 10,000 to 1 lakh and even further is kind of too fast. That is something an exponential nature, and that is what countries are trying to avoid. 549 visitors saw this quiz and started it. So obviously out of them 476 people have answered this quiz. I'll be talking about the feedback at the end. The next question, do you need to wear a mask when you step outside your home for any essential work? Yes, you need to wear the masks, and it has been recommended by government and WHO. And the government are trying or have given their advisory, which is even if you are going out for simple jogging, running, or whether you are going out for purchasing something, whenever you are heading out of your home, make sure that you are wearing mask. This has been recommended and this should be followed. And you can also consider that post COVID-19 world would have to take care of their health and hygiene whenever they are stepping outside. Who are the frontline workers during COVID-19 pandemic? So there were different options: doctors, medical staff, police and volunteer, food and grocery suppliers. Well, every one of these is COVID-19 frontline worker. We have really kind of dedicated all of our work as of now to these frontline workers. Those who have just selected doctors and medical staff, please note that police and volunteers are working very hard even to take care of the law and maintenance situation. Food and grocery suppliers are also taking care of our daily needs. So everyone, whoever is working at this time with facing the consequence of possibility of getting virus more as compared to someone who is sitting at home, is a frontline worker. So all of the above are the frontline workers. Now the next question is a question based on MATLAB, the application which we had built. Which of the option is showing flattening of the curve? As you will notice, there are different country figures, and again notice that this data is until April 9th. So for India, this is showing an exponential curve. China is the country which had flattened the curve, so obviously that was the correct answer for it. And you can see the curve which is at the onset of March and April is completely straight, and not exactly straight, then also it's not incrementing much. So that is what flattening of the curve is referring over here. Another example we had taken as an option were Australia. So they have done good work in the recent time, and that's a good sign for them. But till 9th April it was in exponential nature. Again with USA, it was an exponential nature. The numbers which are increasing in USA is too high. Still approximately 20,000 people are having this disease on a daily basis, so that's a very big number. Then we have Italy, so one of the worst affected countries at the initial stage, again showing an exponential curve. And then you have Pakistan, again an exponential curve, and still kind of the numbers are increasing in the similar fashion. So the correct answer for this is China. The curve which is getting flattened out is the one of China, and rest of the countries are having exponential curve. Moving to the next question. The first case of COVID-19 was identified in. The correct answer to that is Wuhan, Hubei, China. There are still debates among countries, politics being played about this thing. So we are not going to discuss about anything like that, but whatever the information is published online, whether it's on Wikipedia or main sources, the first COVID-19 case was identified in Wuhan, Hubei, China. Now this question is something which is new for most of you guys. While using import data tool in MATLAB, import selection can, what can it do? Most of the people have selected import data as the option, but that is not the correct thing. It's not that only correct. Other options, that is generate live script, generate script, and generate function, are also the correct option. This means all of the above is the correct answer for it. Using import data tool in MATLAB, you will be able to do all these things once you have selected your file. So you can directly import the data into your workspace, or you can generate a live script which allows you to fetch the data in MATLAB. You can generate a normal script, or you can generate a function. So moving ahead, which of the following graphics does not have linear scale in both the axes? Now we have 4 graphs in it, and I would specifically highlight what is the function name written which has been selected. The first option was having log function, so both the x-axis and y-axis are logarithmic. Second option is semi-log y, where y-axis is in logarithmic scale. The third option is stairs, where both the x and y-axis are in linear scale. And the fourth option was semi-log x, where x-axis is in logarithmic scale. The question again is where both the axes are not linear, does not have linear scale in both the axes, which means both have log axis, and the correct answer to this question is log. 96 people among the 431 who have answered this are correct. If you see the curve over here, the chart over here, approximately everyone have actually given a different answer. So 25%, I would say, generally have given that different answers to this question. So the correct answer for this is log, where both the scales are in logarithmic and not linear scales. The next question is, which of the following most accurately reflect the estimated period of COVID-19? The general period is that within 2 to 14 days, the symptoms of COVID-19 can get shown and can get impacted. So the correct option over here is period equals to period divided by 24. We have used converting hours to days, and then we have compared period should be greater than or equal to 2 and period should be less than or equal to 40 in terms of days. So the next question is, how can we display the MATLAB date time variable date into a MATLAB display statement? There are 4 options, and importantly the difference is %f, %e, %s and %t. Date is usually taken up as a string, so that's why the correct option would be %s as a date. You would be able to import MATLAB date time variable date into MATLAB using fprintf %s, date. The people have actually selected multiple options in it, as you can see, so it's important that you use the proper approach. Moving to the next question, you cannot protect yourself or you can even spread the virus to others if you, there are different suggestions in it. Wash your hands regularly for seconds with soap and water or alcohol based hand rub. 20 seconds is the time which has been recommended by WHO and other health organization to do the same. But that's a proper thing to do. Cover your nose and mouth with a disposable tissue or flexed elbow when you cough or sneeze. Again, thing which you are supposed to do. Avoiding close contact with unwell people, approximately 6 feet, is something which has been recommended. Touching your eyes, nose or mouth if your hands are not clean. This is the sentence which, if you do, you are not protecting yourself or you can impact others if you do the same. So the correct answer to the question is touch your eyes, nose or mouth if your hands are not clean. The next question is, how will we calculate the coronavirus mortality rate for a country in MATLAB? The mortality rate of a particular disease is considered as total death divided by total population. However, in this case, when we are talking about COVID-19 mortality rate, we would be saying total death divided by total cases. So the correct option is rate equals to total death divided by total cases. Next question is, in which age group the COVID-19 spreads? Well, recent development have seen even the newborn babies are having the COVID-19. So there's no specific age group. It can spread in all age group. It's mild in children. That is also a true statement. older person and person with pre-existing medical condition are at higher risk to develop serious illness. So all the statements are correct, and that's why the last option is the correct answer for it. The next question is, which function can be used to create a horizontal bar graph? When you use bar function, it creates vertical bars. If you are supposed to use horizontal bar graph, you need to use bar h function. So the correct answer is bar h for it. Moving to the next question, among the shown plots, which figure signifies least amount of coronavirus death as of 9th April 2020? In this figure, you will notice that there are two curves in each figure. One curve is indicating total cases and another curve is indicating total deaths. The red curve is indicating the death, and we need to compare this in order to understand the real or the solution for it. If you notice, these numbers are approximately 4,500 for total cases and very near to 0 and in between 500 for Pakistan. For India, it's the similar figure, but it's between 0 to 1000. For Italy, it's between 0 to 2 multiplied by 10 raised to 4. And for Australia, this figure is between 0 to 1000. However, if you notice that we are also showing these number over here, total death, you can simply see that and select the correct option. Total death within the figure is shown 50 for Australia. For Italy, it has been shown 17,000 and something. For India, it has been shown 166, I believe. And for Pakistan, it has been shown 63. The correct option for this is Australia. Moving to the next question. What happens to a person suffering from COVID-19? So all of these options are correct, and these are around 80% of the people will require no treatment as such and will recover on their own. About 25% or less than 25% may need hospitalization, and a tiny proportion suffering from chronic illness may need admission in an ICU. While using import data tool in MATLAB, what kind of output type be achieved? So using import data in MATLAB, you can either produce table, column vector, numeric matrix, string array, cell array. All of these are correct option. So the real answer is all of the above. Area under a curve is representation of integration. So area under a curve means integration. In MATLAB, we use area function to indicate the spread, and that is something which is normally an integration. What kind of mask should be a non-frontline person wear? So this is like true or false kind of thing. So most of you have selected surgical cloth mask and leave specialized mask for doctor, nurse and volunteer. That's a correct statement. We are trying to emphasize that we need to dedicate things or make the things available for frontline workers first. So cloth mask should be used by non-frontline workers, and specialized mask, for example N95, should be used by doctor, nurses and volunteers who are in direct contact with the cases. If C is a cell array containing different country names with repetition, how can we obtain a cell array with unique country names? So the options are unique of C, categories, bracket, categorical C, both of the above, none of the above. Correct option is both of the above. Unique of C has been selected by most of you guys, so that is correct, as it's normal to know. Now categorical divides the different options into different possible categories, and categories also use that function to differentiate between them. So this is also a correct approach, and I have shown that during the webinar, and both of these are the correct option to obtain the unique country names when there are repetition happening. Moving to the next question, which input argument property is used to show square while plotting the data in MATLAB? Options are line style, marker, color and line width. So marker is used to indicate different stickers or different kind of points for the square which are currently being shown in the different figures you are seeing. So marker is the correct option for this thing. The next question is, which is not a proper line style in MATLAB plot? So options are dash, dash dot, colon and dot dot. So dot dot is the incorrect approach and correct answer to the question. This is not a line style which can be followed in Matplotlib, and rest of the three are possible in MATLAB. This has been selected, the colon has been selected by most of you guys, but that is a possible thing to do, use as a line style property. Moving to the next question, which of the following is the most commonly reported clinical finding in patients with COVID-19? Sneezing, hypertension, diarrhea and fever. So the correct answer is fever. That is the most commonly reported clinical finding in the patients of COVID-19. As you will be noticing, the more we are going downwards, the number of answers are decreasing. So people are living while participating in it. If you have participated until the last stage, that means you are that person who are being counted in these numbers, and your answer is also being considered in these analysis which we are doing currently. So moving to the next question, which function can generate an animated graph in which a circle, the head, traces the data points on the screen? The option are stairs, stacked plot, comet and bar H. The correct answer is comet, which has been selected by most of you. Using comet, we are able to use an animated graph from where the object is moving. So how the data is traveling can be easily seen through the comet plot. The next question, and this question gets divided into two people. So some of you are seeing the question, choose a statement which is not a fact but myth regarding coronavirus, this one, and or the other question over there. Both are similar question. So this has divided the number of people. Now the options, rather than speaking all the option, I'll just choose the proper thing. Spraying alcohol or chlorine all over your body will kill virus that have already entered your body. That is an incorrect thing and a myth. So that is not true thing. Spraying alcohol or chlorine will not kill your virus which has entered your body. And again, choose the statement which is a myth. So ultraviolet light should be used for sterilization and killing the virus. That is again a myth. Ultraviolet light cannot sterilize you or kill the virus. The next question is, which function used to show different curves within the plot? And this is also the last question of the quiz. The options were X label, Y label, legend and grid. The correct answer is legend, and most of you have selected the proper answer. So approximately 64% people have really answered it correctly. So with this, we have actually done the discussion of all the questions, and I'm really pleased to know the feedback which you guys gave for these questions. At the end of the quiz, I did ask about the feedback, whatever the feedback you guys have. So I wish to show you all possible scenarios which you guys have given regarding the feedback of this quiz, and I would like to bring out those things within this video. One of the feedback was, you can improve by giving more difficult question because by now people should know the basics. To the person who has given this feedback, I would like to say, like, obviously people are knowing about it, but still it is something which we would like to know, we would like to give the basics of the disease. So if we start giving the hard questions, I still feel that the quiz isn't hard, and even if this is something you feel is too basic, it's even not too basic. You are a good MATLAB enthusiast, so that you are able to answer the question in a really good manner. It's an interesting quiz for the MATLAB enthusiasts, and it helps the people for testing their knowledge regarding the ongoing pandemic coronavirus, helps in getting some basic knowledge of productive method. It's great. Thanks for your feedback. Another feedback we have received and repeated, so probably it's from the same group of person. It's very exciting to all the MATLAB enthusiasts and helps in testing the knowledge about coronavirus, which is very important. Okay, moving downwards. So generally the feedback is 2 words, nice or good or something, but I am trying to highlight the feedback which have actually touched me. It's a good initiative of the team for helping us to get to know the real understanding of the COVID-19. It's really helped me think of the use of the youth in ensuring the correct information is attained by people regarding the spread of COVID-19. So people like you who are spreading the awareness of this quiz and generally the awareness of COVID-19 are the people who are doing good work. Please continue doing that kind of work and help us as well in spreading this thing. Moving further, the quiz like these are able to inject some more brightness in our mind. So I respect these types of quizzes to do more by you people to create awareness among the people. Thank you, MATLAB, for giving such a beautiful opportunity for us to participate in this quiz. Well, thank you for giving your kind words, and hopefully we'll be able to have more of such quizzes. Currently, we have a like at this time in May month, the quiz is going on a stock market with based on our course on stock market application. You might wish to try out that quiz as well. So if I keep scrolling down, you will see lots of positive other feedback. Great test. The test seemed to be very easy, but not really. It's a wide range of fact and details which everyone should know right now. Thanks for MATLAB Helper for creating this quiz to create awareness among people and let them know how well they know about the disastrous global pandemic COVID-19. Many thanks to the Government of India frontline staff for giving the best they can in this alarming situation. So obviously the Government of India as well as the government of various countries is doing good work. People like you are also taking precautions in doing the activities. More ease is happening with day by day as the COVID-19 is passing on, but we still need to take care and make sure that we don't get an upsurge of the numbers for the COVID-19 cases. I read this feedback. The quiz is great, knowledgeable. So I have tried hard to score the 75%. No doubt I have failed 5 to 6 times but succeeded in the end. Thanks to the MATLAB Helper for organizing such MATLAB quiz on COVID-19 along with some MATLAB questions seem easy but tricky too, but happy to score more than 75% plus. Well, great to know that you have scored 75% plus and you found this quiz interesting. Easy, hard, tricky, whatever you think. It's a quiz which is dedicated to the people like all of you. Just reading the last feedback now. The outbreak of COVID-19 has created a global health crisis that has had a deep impact on the way we perceive our world and our everyday lives. Not only the rate of contagion and patterns of transmission threatens our sense of agency, but the safety measures put in place to contain the spread of the virus also require social distancing by refraining from doing what is inherently human, which is to find solace in the company. Well, that's a good thought in a way. You think it was good? That's a good to know. Thank you everyone for your fantastic feedback and response. For May 2020, our monthly quiz has already been made live with the theme on stock market with MATLAB. You are advised to participate in that quiz as well after watching this video. We are hoping for some good signs to come up soon for COVID-19 with the big relief package already announced, and I hope that you are safe wherever you are in this world. We are working with the feeling of Vasudhaiva Kutumbakam, that is, the word is one family. Thank you for watching this video. Do like this video if you found it useful. If you have any query, post it in the comments or get in touch with us. Follow us on LinkedIn, Facebook and subscribe to our YouTube channel. Education is our future, MATLAB is our future. Happy MATLABing.